How dangerous is sex when you are suffering from heart disease? Life-threatening arrhythmias and even death are something that many patients are afraid of. But even healthy men and women are often concerned when they reach a certain age associated with risk. In this video, I will explain to you the dangers involved when having heart disease and engaging in sexual activity. I will discuss coronary artery disease, cardiomyopathy, and patients with ICDs, that's pacemakers. Good news first. The risk of a major cardiac event during or after sex is very unlikely. Research has shown for many years that the risk is far less than 1%. With sex still being a topic of taboo among patients and also doctors, cardiologists often avoid addressing this area. Sex involves physical activity. But how strenuous is having sex? Believe it or not, there is some research about that from healthy volunteers. Foreplay to orgasm, engaging in various sexual activities and positions, requires 3 to 5 metabolic equivalents of task. So, how much is that in comparison? The average duration of sexual activity is around 30 minutes. If you are at church and praise with dance or do a spiritual dancing in church for 30 minutes, that equals 5 metabolic equivalents. If you are doing some home repair work and hammer nails for 30 minutes, this is how 3 metabolic equivalents feel like. So in principle, every heart patient fit enough for hammering nails at home or dance at church is fit enough for sex. Let's look at the details. Group number 1 is coronary artery disease. As I already pointed out, it is safe to resume sexual activity in terms of arrhythmia and myocardial infarction with ischemic heart disease. In the very unlikely case this should happen nevertheless, those who are trained in cardiopulmonary resuscitation, CPR, have a big advantage. If your partner is trained in CPR, your chances of survival will increase by the factor of 5. This would also be my tip. Learn how to do CPR. Besides the sexual context, you never know. Maybe you will need it in an emergency situation one day. Tip number 2 is to stay away from recreational sexual enhancers, like the so-called poppers, as these may trigger cardiac events in heart patients. Group number 2 are those with the different cardiomyopathies. Even here, cardiac events are rare, under the condition that these patients are well controlled on their respective medications. In a small subset of patients with long QT syndrome, there is possibly a slightly increased risk for those with type 2 with a mutation in the KCNH2 gene. Treatment with beta blockers in these patients can decrease the likelihood of arrhythmias. Finally, there is group 3, and that's those with cardiomyopathies with implantable cardioverter-defibrillators, so-called ICDs. A frequent concern is that the device may become active and shock them under sexual activity. This is a common concern in both patients and their partners. This concern may lead them to avoid sexual activity altogether. If they can perform activities within the 3 to 5 med range without problems, then there shouldn't be any concern regarding sex. If they are able to do that, can be tested at the doctor's office on a treadmill, for example. If they don't have the capacity, cardiac rehabilitation could be useful to get them into that necessary physical shape. In addition to that, goal-directed medication may also help to improve the arrhythmia burden. One problem with medication is that many of those used for the heart lead to erectile dysfunction as a side effect. Many patients are afraid of medication due to the risk of side effects. All of this may lead to a discontinuation, and this will put them at an elevated risk when engaging in sexual activity. Here is some encouraging data from the CARPHILLY study in South Wales in the UK. It was a longitudinal study in 914 middle-aged men over the course of 20 years. The researchers were looking at stroke and coronary heart disease and found a protective effect between frequency of sexual intercourse and fatal coronary heart disease events. The high-frequency group, which had sex more than twice a week, showed a protective effect. However, research has shown that certain characteristics are indeed linked to an increased risk of fatal cardiac events. The typical representative of this group is a middle-aged man at risk of ischemic heart disease having sex with a younger partner during an extramarital affair in an unfamiliar setting. Thanks for watching. Bye-bye.